So we are going to be looking at a rotatable heart. I'm assuming you've already done the activity where you go to a three-dimensional software website and you look and pin the heart. So this is more to play around with the unattached heart. So here's a heart. And like our other models, you could grab it, rotate left, ooh, it opens, right, and you can use the arrows. These are all different hotkeys. A lot of these are just lab book pictures. So that's the posterior surface of the heart. So a lot of it's just going to take you to lab book pictures. So the heart. The heart sits in the thoracic cavity. And the pointy apex here is pointing into the left lung. We're going to learn this is called the cardiac impression right there. So here's the heart. We have our intraventricular sulcus right there. There's the apex. This is the left side of the heart. It's the patient's left. This is the right side of the heart. It's the patient's right. And unfortunately, the thymus here is covering up a lot of the cool stuff on top. So here's our heart. And to actually orient it right, I'm going to grab it and point it. So the apex here is pointing into what the left lung would be. And this is the right surface, or the right border, because this is the right side of the heart. Now we have this cute little ear up here called an auricle. And this is going to house the atria. So see, it opens up. So this chamber in here is the atria. The auricle is the external structure. So we have a sulcus between the auricle and the ventricles. This sulcus is between the atria and the ventricle. It is the right atrial ventricular sulcus. And the right coronary artery is going down it. And it's going to branch right there into the right marginal artery. And then this goes and becomes the posterior intraventricular artery. So this would be the ventricle here. And we have a couple of our great vessels. This is the superior vena cava, and this is the inferior vena cava. Now the superior vena cava is actually very short. It ends right here. These are going to be the brachiocephalic veins. They're coming in from the shoulder. So if we look at this picture, here is the subclavian vein. Here's the jugular vein. They merge and become the two brachiocephalic veins. They become the superior vena cava, and that is going to empty into this right atrium. Now here's the inferior vena cava. There are the hepatic veins, goes to the diaphragm, and it too empties in the right atrium. Now, this is the aorta. That is coming off of the left ventricle, which is going to be over here. And it's going to take blood to the body. This right here is the pulmonary trunk. It's going to branch into the left and right pulmonary arteries. So here I'm moving it a little bit. This is the right atrium. This is the right ventricle. And if you spin it to the right place, it opens up, and we can see the valves. Here is the pulmonary semilunar valve. It goes into the pulmonary trunk. Here is the tricuspid valve, which is between the right atrium and the right ventricle. So I am spinning it a little bit more. So now we're looking at what the front view would be. Remember, the right side is actually facing anteriorly. So we have two auricles. Here's the right auricle, here's the left auricle. They really do look like little ears. This is the right atrial ventricular sulcus. This is the left. Now there's a sulcus between the two ventricles right here. This is the anterior atrial ventricular sulcus. And in it are two arteries. We have the anterior atrial ventricular artery and the great cardiac vein. The great cardiac vein is actually starting here at the apex. It goes up and through the left atrial ventricular sulcus. Now, the intraventricular artery, anterior, that is, branches from the left coronary artery. The other branch here is going to be the circumflex artery, and that actually circles all the way around to the posterior side. So here's the left side view. Here's our pulmonary trunk. There's our aorta going up. We can see the three smaller vessels that come off of it. This is the brachiocephalic artery. It is going to become the right subclavian and right carotid. This is the left carotid. This is the left subclavian. So unfortunately, the brachiocephalic vein is covering it, but here is the arch of the aorta. So this right here would be the brachiocephalic artery. There's only one, and it's branching into the right subclavian and the right carotid. The left carotid comes off, and so in the middle, this is the left subclavian. So I'm going to keep rotating, and we're going to open it up now. This is the left atrium. It's in the auricle is the external structure, and this is the left ventricle. We have blood from the pulmonary veins coming into the atrium. It goes through the bicuspid or mitral valve into the ventricle. So I zoomed in a little bit. Way back here, hiding, that is the aortal semilunar valve. It actually goes up and sends blood into the arch of the aorta. There's the descending aorta right there. And so we're on the left side now. Here is the left border. Here is the pulmonary veins. These are the left pulmonary veins. There's some on the right side. That's actually the left, probably primary bronchi, because it hasn't split yet. Left pulmonary artery. It's going to the lungs from the heart, so it's an artery. These are going back to the heart from the lungs, so they're veins. And we can see the circumflex artery and the great cardiac vein going around. And we keep going around to the posterior surface. And it's going to be really hard seeing what is there. So here's the posterior of the heart. There is where the great cardiac vein and the small cardiac vein and the middle cardiac vein drain into the coronary sinus. And it's going to drain into the right atria, which would be right about there. We have a sulcus on the back right here. This sulcus, we have the right coronary artery that branched from the marginal. It's going, that artery is the posterior intraventricular artery now. It goes down the posterior intraventricular sulcus. And last but not least, we have the small cardiac vein going up. So spin the model around, try to find all those landmarks. It gets to a point here where it pops open so you can see the internal structures too. And that is our heart. Thank you.